Special infant preparations are crucial during extended dwell catheter insertions, especially when it comes to comfort and positioning. Comfort is key to minimizing pain, agitation, and crying. This not only helps the infant feel more at ease, but also reduces the risk of missed attempts and unnecessary needle sticks. Care must be individualized and developmentally appropriate. Swaddling the infant with the access limb exposed is one effective way to provide a sense of security. But we must always tailor our strategies to meet each infant's unique needs. In terms of technical considerations, it's important to ensure that EKG leads are positioned properly, avoiding obstruction of the X-ray imaging during catheter tip placement. Additionally, for arm vein insertions, gently turning the infant's head to the opposite side, either before or after the catheter passes the shoulder, helps to narrow the angle to the internal jugular vein, ensuring proper catheter. What is special consideration for PICC nurse insertion? PICC nurse first review the history of the suitable vein. We have the form that is not a part of the documentation in the bedside chart, binder for bedside nurses to follow. We will mark the suitable site for PICC line. Please follow the instructions. Procedure guidelines. PICC line dressing changes will be performed by the PICC team. PICC, RN PICC, RN Task Force trained neonatologist. Procedure guidelines. PICC line dressing changes. What are the signs of immediate indications for dressing change? Dressing is not intact. Reinforced with tape. Change dressing only if. Non-occlusive dressing. Not intact dressing is reinforced with tapes. Mandatory change within 7 days if using a hemostatic product such as BioPatch. Important reminders: do not reinforce dressing with tape. Submerge dressing under water at any time. When it comes to dressing changes, the PICC team has several key responsibilities. First, confirm the timing with the infant's nurse and make sure they're present at the bedside. Always maintain the safety bubble range throughout the procedure and delay any cleaning or trash removal until it's complete. Lastly, everyone within 3 feet of the procedure area must wear a hat and mask to maintain a sterile field.